Hello and welcome to our Moxy webinar on freediving training. Our presenter today is Jaap Verbaas. Jaap just completed a PhD at Simon Fraser University. He started freediving in 2013 and he started the online Freedive Wire in 2015. Jaap is a new Moxy user and he will share some of the interesting observations he's had in using the Moxy with dryland training so far. So even though this webinar is focused on freediving, I think the approach that Jaap is taking here of verifying that certain exercises have the desired physiologic response is a very good approach and probably applies to many other sports as well. So the format for the webinar today, we've got about a 30-minute or so presentation. We're going to stop about halfway through and take a couple of questions at the midpoint. You can type questions into the questions panel on the right side of your screen, and you can type those in at any time. And so we'll take a couple of questions at the halfway point, and then Jaap will finish up the presentation, and we'll do some more Q&A at the end. And this recording of the webinar will be posted on our website after we're done. So with that, I will turn things over to Jaap.
All right, thanks, Roger. The results that I'm going to present are I obtained the data in 2 sessions at GTech Health in Vancouver, and that's with the help of Greg Elliott, and he is located at the Fit to Train office. Another thing I'd like to say beforehand is just that I'm not financially affiliated to Moxy, so all this is I'm not trying to earn money with this webinar. I'm just doing this out of interest and to create content for Freedive Wire. Okay, so first of all, short disclaimer, be safe, take care, don't do a lot of breath hold exercise on your own, because obviously there's the risk of you blacking out and falling on the floor. What we'll discuss here, first some background information, how is energy and oxygen used in the muscles during freediving, and then I want to get into some more specific freediving exercises, the exercises that don't work and exercises that might work. And central to this question, or to the presentation, is, to what extent can we actually deplete muscle oxygen stores, and is it possible to induce the genesis of myoglobin with dry training? So I'll give you an answer to the first question, and I'll speculate on the second. Okay, oxygen transport to the muscles. As you know, we take in oxygen through our lungs as we breathe in. That oxygen is transported through the arterial system to capillaries that line our muscles, and from there, myoglobin scavenges the oxygen that is present in the capillaries and transports it to the mitochondria in muscle cells, which are the energy factories of our muscles. Now, the mammalian dive reflex is what allows us to dive. It's caused by facial cooling and hypoxia, and it triggers a response that conserves oxygen for the vital organs. Part of this response is vasoconstriction and blood shift. And vasoconstriction and blood shift have the effect that blood doesn't reach the muscles, or it does so in very limited quantities. And of course, that means that oxygen doesn't reach the muscles. It also means that waste is not removed from the muscles, and the functioning of the muscle cell must occur without the supply of blood-borne O2. So this is the way in which freediving really is different from other sports. So this connection here, the connection between that arterial system and the capillaries that line the muscles, is really, it's practically non-existent during a deep dive. Pulse oximetry. This is what we tend to use for, or what I tend to use for recording my workouts. And pulse oximetry measures in that compartment, if you will, the arterial system and the lungs. So it measures arterial oxygenation, heart rate, and that reading is delayed because of the perfusion to the fingers. So it's not uncommon to to stop an exercise, and when you start breathing, it can take up to 30 seconds for the reading to show up on that oximeter. Now, the Moxy measures where you need it to measure. It measures right on the muscles. So it measures total oxygen, a combination of hemoglobin and myoglobin. There's no delay in that measurement, but then there's no heart rate measurement. So there's actually no pulsatile blood flow in the capillary. So no matter how much you want it, the Moxy itself won't actually tell you your heart rate. So you can use a heart rate strap in combination with the Moxy and still get that data. Okay, processes in the muscle cell without the supply of blood-borne oxygen. So imagine that, you know, the capillaries don't exist for a second, then what would happen? Well, we have high-energy phosphates that are present in the muscle cells. This is the first reservoir of energy that will be used when you start an exercise, and it's sort of your battery. It's usually, or colloquially, referred to as the ATP CD battery. And that's able to deliver about 10 to 15 seconds of maximum power. Myoglobin will release its oxygen for aerobic metabolism once you've used that ATP-CP, and after that, lactic anaerobic metabolism will be the predominant metabolic pathway that can supply you with energy. Okay, now training for optimizing our muscles to use ATP-CP or lactic anaerobic metabolism is fairly straightforward. It's simply powerlifting or doing specific endurance exercises, high-intensity interval training, etc. And so I don't want to dwell on that too much. I want to get into what myoglobin might do for us. As I said, myoglobin transports oxygen from the capillaries to the mitochondria. It predominantly occurs in slow-twitch fiber. Slow-twitch fiber is the fiber that you use for walking and submaximal exercise. It contains a heme group that binds oxygen, so it's an iron-carrying protein similar to hemoglobin. And this is why I'm so interested in it. Muscles of seals and other diving mammals contain high quantities of myoglobin, so it functions as an oxygen store. And even more interesting is that a lot of these animals are not born with high amounts of myoglobin in their muscles. Instead, they obtain that by a lot of diving. So it's just simple practice. So you wonder if we can do the same. Endurance athletes, we know, have increased myoglobin, but we want to increase myoglobin without increasing vascularization of the muscle. So we want to become independent of blood-borne oxygen because that will allow us to dive longer. All right, so first then, what we need to know is if we can induce vasoconstriction on land. Here, so these, I'll dwell a bit on this graph. This graph shows you the kind of numbers that the Moxy in combination with a heart rate monitor gives you. And in blue here, you can see SMO2, which stands for muscle oxygen. In gray, you can see heart rate. And in orange, you see THB, which stands for, it's a measure of the total blood flow to the muscles. And with the black dots here, I've indicated the start of a breath hold. So what I'm doing here, this is the start of a session. I'm doing 2 breath holds on residual volume, so a forceful exhale. And you can see after this first breath hold, or during this first breath hold, my heart rate drops like a rock. SMO2 goes down a bit. And then it goes up shortly after I start breathing again. You can see that I start breathing here by that nearly instantaneous increase in heart rate. Second breath hold, my muscle oxygen drops lower, heart rate drops to about 37, and after I start breathing again, the muscle oxygen goes up, and after a minute or so, everything re-equilibrates. Okay, so the oxygen saturation that I measured in my with my pulse oximeter was 97 and 96 on these breath holds, and that's really within the error margin of a normal reading. The error margin on my oximeter is about 3% at these whenever it's over 80%. So I can't even statistically say that this is different from a reading at 98%. The fact that muscle oxygen drops during these breath holds shows that there is some measure of vasoconstriction, and that vasoconstriction after the even after the breath holds are done, it seems to kind of hold, and you can see that in that decrease in blood flow after the breath holds are done. So second time I start breathing again, you know, the SMO2 goes up, it's a compensatory response, and then it equilibrates around this value, about 67%. But blood flow is lower after those breath holds. Okay. I want to show you a set of apnea walks. Now, I wrote an article on apnea walks a few months ago, and apnea walks are really exactly what they sound like. You hold your breath and you start walking, but you can do it in several ways. You can inhale, start your walk. You can inhale, wait until contractions, and then start your walk. For those of you who are listening that are not freedivers, contractions are involuntary muscle movements of the diaphragm. It's basically your body asking for air. And another way of doing them is to exhale, do a short static, and then start walking. And this is, I think, the way that I describe them on Freedive Wire. And what I usually do is I target a specific oxygen saturation around 80%. Okay, so walking while holding breath on an inhale. Again, these are two apnea walks. The start of the apnea walk is indicated with the black dot here. You can see muscle oxygen drops to about 48% on the first, drops to about 40% on the second. So that really is still fairly high. And blood flow to the muscles on the first walk, which is here, appears to be fairly constant, but it rises at the end of the second walk. So, of course, that blood flow and SMO2, that, you know, your body, there's all these feedback mechanisms in your body that try to keep your muscles oxygenated so that you can still do your exercise. And the limit to these, to the length of my apnea walks, I think, is CO2 tolerance. So I don't find these apnea walks on an inhale very comfortable. I get contractions fairly early, and that's why I want to breathe. It's not because I am about to collapse, and that's same. The SMO2 shows that same thing. It's not very low. Okay, so 120 seconds static followed by 40 to 60 seconds of walking. You can see muscle oxygen drops during the static, and as I start walking, which is here, SMO2 first shoots up a little bit. That's kind of funny, but I think that's actually because I'm standing up. So I'm sitting first and standing here. You're seeing the effect of gravity, and then it drops as I keep walking, and just goes back up after I breathe in, which is right there. Same thing on the second walk, and the lowest values that I reach here are about 43%, I believe. So again, SMO2 stays relatively high. Blood flow to the muscles, you can see here and here, increases during the walk. And again, I'm training CO2 tolerance. It's not, I don't think I'm depleting SMO2 enough to be training much else here. Okay, exhale, 20 seconds static followed by 40 to 60 seconds of walking. SMO2 again stays relatively high, doesn't drop below 40. Blood flow to the muscles increases during the walk, and it's limited by CO2 tolerance. Okay, so SMO2 doesn't drop during any of these apnea walks, doesn't drop below 40%. Blood flow to the muscles simply increases during exercise, and doing a static prior to the walk doesn't appear to make a difference. CO2 tolerance is limiting for these exercises. Okay, so then I tried a set of wall sits and a one-leg stand, and there's a lot of things going on in this graph, so I'll walk you through it. But I choose wall sits and one-leg stands because they're shown in some manuals to be important, and of course I wanted to test that. So here is a wall sit, this first wall sit. I don't do a static beforehand, full inhale, and then I lean against the wall with my legs at 90 degrees. So it's a fairly strenuous exercise. And what you can see is that SMO2 drops rapidly at the start, goes down to about 36, and then it goes right back up. And it actually, here, it decreases again by a bit, and it finally decreases as I take my first breath in. I'm not sure why, or as I exhale. Not sure why that little dip is there, but it seems to be consistent. Okay, second wall sit, take a breath in. I do a 2-minute static and about a 1-minute wall sit. And here you can see again that after that initial SMO2 drop, it starts going up again. So I saw that increase and I decided to stop because I wanted to save my legs for other exercises as well and didn't think it was going to be much lower. And this little drop again is because of my exhale. All right, so doing wall sits and one-leg stands while breathing is another thing that some people advocate. Why don't you just do a wall sit or a one-leg stand or another strenuous exercise all the way down to failure? Because then you're probably desaturating the muscle of all oxygen, etc., etc. So I tried that, and here is a wall sit. And you can see again that here SMO2, it drops very rapidly, and then it just climbs right back up again. So that doesn't seem to work very well. And the little ups and downs here, I think, are my individual breaths that you're seeing. So there's a lot of detail like that the Moxy picks up in these exercises. All right, so why not just simply do it with one leg instead of two? Tried that as well, and again, SMO2 drops very rapidly at the start, but then here it starts just creeping up again. And this is where I take my breath, when it really starts shooting up. So, so it shows you that the vasoconstriction is really kind of negated at the onset of exercise. So neither apnea walks, wall sits, or one-leg stands fully deprive the legs of oxygen. The exercises that are shown are probably more effective for training CO2 tolerance and lactic anaerobic metabolism than for increasing myoglobin. And the muscle failure is not due to, nor does it correlate to, a lack of oxygen in the muscles. More strenuous exercises, of course, cause a greater decrease in SMO2. And a small degree of vasoconstriction is induced on land, but the effect is negated at the onset of exercise.
Okay, Jaap, if I could interrupt here for just a minute, we've got a couple of questions here. Mm-hmm. So the first one is, where was the Moxy sensor placed on the body during the breath holds? Right,
that's a great question. I should have said that right at the start, of course. The Moxy was placed on my quad, on my left quad, about midway between the knee and the hip.
Okay, were you aiming more for the VL off to the side, or? Yep. Okay.
Yep, VL.
Another question here. Do we know that myoglobin desaturation causes more myoglobin to be produced?
No, we don't. And I'd like to get into that a bit more at the end, but The only way we're going to know that is if we, if we do a controlled trial with muscle biopsies. We simply can't tell otherwise. But unless we are desaturating the muscles of oxygen, I don't think we'll stand a fighting chance at all. So I believe that if the myoglobin system is stretched, in that if you were to induce myoglobin desaturation to maybe P50, or so let's say myoglobin desaturation is at 50%, then the body might naturally generate more, and it's not different from generating more hemoglobin, right? You desaturate it periodically, it'll cause the body to create more of it.
Okay. One more right here, quick. What level of CO2 tolerance is safe?
That's a good question. It's not something I can directly answer, but I think CO2, the buildup of CO2 can cause headaches and other nasty effects that aren't that I don't think many people get from doing a breath hold. So overall, I don't think I haven't ever heard of anybody accumulating so much CO2 during an apnea walk or another apnea exercise that it would become dangerous. Whereas if I do specific exercises on a bike, I can get, like restricting my breathing rate while I'm cycling, in which case you accumulate massive amounts of CO2. Then I can get headaches and and other bad effects. If you want to see the full set of side effects from CO2 accumulation, you should Google hypercapnia and check out the Wikipedia page. There's a good description on there about what you might expect, and before what levels you might want to stop.
Okay, we got one more question here, kind of on the same topic. How can we determine the limit of CO2 tolerance? I was able to improve my breath from 50 seconds to 4 minutes using CO2 tables and Moxy. This translates in extension of my cycling sprints by 10 seconds at the same power. But what could be the limit?
What could be the limit so the limit of CO2 tolerance is, it's the problem is really, I think, that we can't really measure it, of course. And when you're training for breath holds, you're not only, even if you're doing CO2 tables, you're not simply training for CO2 alone, you're also becoming more comfortable with breath holds, and your dive reflex might start to get stronger. So it's hard to tell that way, but I tend to only stop when I start feeling, if I'm doing a CO2 exercise on a bike, I only stop once I get a very light headache. But then that's also, right away, that's it, I stop.
Okay. Okay, great. Just a reminder, if anyone else wants to get some questions in, you can type them in on the right side of your screen in the questions panel. So we'll let Jaap finish up the presentation, and then we'll have a longer Q&A session at the end.
All right, thank you. Okay, so what I started suspecting that these apnea walks weren't really getting I wasn't getting the effect that I wanted. So I started doing short recovery, interval, isometric exercises, and the reason is that if you use a short recovery, it reduces the amount of high energy phosphates that are present in the muscle cells prior to your exercise, and that makes it easier to lower SMO2. So your ATP CD battery is empty, if you will. And then I use interval, which basically causes you to cycle through high and low SMO2 every few minutes. And I use isometric exercise because it's the simplest way for me to track my progress. I just have to have my notebook next to me and see how much time I spend in a squatting position. So for my exercise, I use squats without weight, so a body weight squat, and I stay in the same position. And then I do a set of squats with a specific time of recovery, a specific time of a static at the start, and that's then followed by the isometric squat. So here I'm using RV squats, 20 seconds, a 20-second static beforehand, followed by a 25-second squat. And so you can see here that I'm doing 3 squats. Again, the black dot indicates the start of the breath hold. And right away you can see that SMO2 is much lower on these squats than for any of the other exercises that I've done before, barring maybe the one leg stand. And doing that for longer. So I'm basically right here, I'm trying to find out how low can I get this SMO2. So here I'm doing a 45-second squat without a static, and you can see here that the SMO2 for the first squat is higher than for the subsequent 2. And this is kind of what I'd expect from this might indicate that ATP CP isn't fully recovered by the time we do the second squat. And this is something that seems fairly consistent. The first squat is commonly doesn't reach as low SMO2 as the subsequent ones. Now here I've also shown the oxygen saturation, which is here in gray. Should have said that in yellow here now is heart rate, gray is oxygen saturation. So this is measured with a handheld oximeter. You can tell from that oxygen saturation that it's, you know, 1, it's delayed, and 2, it doesn't really correspond to what that SMO2 is doing. It's much higher, and it's about as high as for my exhale apnea walks. So you can't really gauge what's going on in your leg from a pulse oximeter. Okay, then I pushed it a little further, do a 15-second static and a 45-second squat. And now SMO2 again for the first squat is higher than for the subsequent 2. And the lowest SMO2 I'm reaching for the latter 2 squats is 7%. And keep in mind that this is a weighted average between myoglobin and hemoglobin. And I think that's the lowest value I have reached during any of these sessions. Now here's some known unknowns, and I don't really know how low is low enough. I don't really know that for SMO2. I'm quite certain that you're causing significant myoglobin desaturation at 7%, but the critical threshold might be at 20%, or it might be at 15%. And also, these values will be different for different people. What do we do to promote the genesis of myoglobin over hemoglobin? Well, presumably you want to keep your oxygen saturation high while decreasing SMO2. This is what happens in diving mammals as well. So just trying to model after these animals, these are the simple 2 factors to keep into account. And then is there a silver bullet exercise? This is something that I'm very interested in. Is there something that works for every freediver without the need to track any metrics, something we can do on dry land? And preferably an exercise that doesn't make your legs feel as if they have been wrung out by King Kong after an Ironman race. If doing a series of squats, and usually I do 12 and not 3, depending of course on how far you take it, that you really get very sore afterwards. But I do think that for freedivers, we can get to a good, you can find a good set of parameters that works for you. So here, what I've shown is the time of these squats, and then the time of breathe up in gray, the time of the static in blue, and the time of the squat itself in orange, and shown that with the average SMO2 on the second and third squat. Remember that the first was always a little bit higher. I think that for every freediver, these parameters can be tweaked. Can be tweaked to make the exercise, the least uncomfortable it can be with still a high payoff. But you have to do the exercises for quite a while to feel the benefit, of course. All right, so some conclusions. Pulse oximetry, we measure at the wrong spot, and it's simply too much delayed. The Moxy measures exactly where it's needed. Different day, different numbers. Roger did tell me that the SMO2 appears to be quite consistent in different training sessions, but the total blood flow might be, the absolute numbers might differ a little. So this, but I haven't tested the Moxy enough from training session to training session to really know. I do think that for different freedivers, the numbers are going to be different. They depend on muscle composition, etc. So it's hard to give somebody a perfect exercise, even if you. It's hard to give somebody a perfect exercise if you don't really iterate. Look at your results, go back to the whiteboard and think of other things and try to come to a best set of exercises that way. But they can be fine-tuned, and especially with the Moxy in combinations with oxygen saturation and heart rate measurements. But the only way we're going to really know whether an exercise induces the genesis of myoglobin is by a controlled trial with muscle biopsies. That's just the way it is, and I don't think we're there yet. Okay, last but not least, I'd like to end with just a note of care. Please do take care when you start doing exercises, especially on residual volume. And I quote Tim Ferriss, otherwise, woe unto your face when gravity opens a can of whoop-ass on your flattened head. Okay.
All right, thank you, Jaap. Great presentation, great insights there. We've got a couple of questions here. Looks like some more coming in. If a person's CO2 tolerance is so high that their urge to breathe is diminished to the point that they pass out from lack of oxygen, would this not be the level of tolerance which becomes unsafe?
Yes, for freediving, it would be the level at which tolerance becomes unsafe. But that it's not the direct effects of hypercapnia that are unsafe. Then it's the indirect effects for what they do on your breath hold. There are ways to, if you're doing dry exercises, there are ways to know that you are becoming low on oxygen. For example, your vision changes a bit once you're down to 70% SaO2. It becomes, and this of course is different for everyone, but for me, it becomes slightly red and a bit darker. At 70%, I'll get moderate tunnel vision, and yeah, so doing dry exercises, you will be able to tell when you're getting low on oxygen. What I tend to do, or what I did do a lot when I started these exercises, was practice in front of a mirror, and that way, if you see your lips going purple, you know it's time to sit back down and breathe.
Okay, the next question is, how does the Moxy sensor work? If you want, I can take a crack at that one.
Sure, I'll leave that to you.
So it uses near-infrared spectroscopy, and we're looking for the color change of the hemoglobin and myoglobin molecules. So they change color, which is the same physics that the pulse oximeter uses, but the algorithm and the optical configuration are designed so that we can infer the oxygenation levels in the muscle layer by getting through the skin and fat. And we do that by measuring with multiple distances between the emitter and detector. So it's just if you Google near-infrared spectroscopy, you'll find all kinds of information on the technology. The Moxy is a bit unique in that it isolates the muscle layer better than any of the other NIRS technologies that are out there. But if you have anything to add to that, please go ahead.
I don't. I think that's a clear answer. Yeah, okay. The one thing I think is that's important to know is that the Moxy gives you one number, and it's the number of total oxygen within the muscle, and that it doesn't separate the relative contributions of hemoglobin versus myoglobin.
Yeah, that's correct, and it's because they're the same color. So the fundamental physics is the same between the two. So the next one we've got here. Curious to hear quick thoughts. I have been practicing static holds for just over a year and have never experienced any real contractions. Max dry static 545. Is this abnormal?
Well, it's some people get no contractions, other people get contractions after 30 seconds. So it's not abnormal. It means, a lot of people use their contractions as a warning sign, right, for when they're diving and they need to start breathing. So I guess in that way it is worrisome in that you don't get that when you're deep. But I don't think that's necessarily abnormal. I would just consider yourself blessed.
Okay, here's the next one. What is the optimum body type for a freediver? Over the 20 years I've trained as martial arts instructor, with my muscle being fast twitch predominant, then as an ultramarathoner with slow twitch predominant, and now weight training with larger muscle mass. Current freedive record holders appear fairly skinny. So what should we aim for?
Yeah, so that's a fantastic question. What I think is that it kind of depends on the way you dive, as well as so. For example, for me, I dive with an 8mm suit in cold water, which means that I need quite a bit of fast twitch muscle to get me down past the first 10 to 15 meters before I start sinking. But there are other divers. If you really always dive in warm water and it takes you much less energy and power to get down to neutral buoyancy, then you might not need that. The nice thing about freediving is that all the three energy systems, ATP CD, aerobic and lactic anaerobic, they all contribute to every dive. So no matter what you focus on, it probably will have a positive effect. Now, if you're really looking for optimal performance, I think that that you might be best off with that slow twitch muscle, and with the idea being that if you can optimize your body to have to dive like a seal, which performs using predominantly slow twitch muscle and low levels of aerobic metabolism, then you might have, that might end up being the winner in the long run.
Okay, we've had one person ask if we can make the presentation available for download. If you're willing to put it up, we can put it up along with the recording.
Sure, I don't see a problem with that.
Okay. It looks like we've got to the end of the questions here, and we're just about out of time as well. So I think we hit that spot on. So thank you again for the great presentation, and thank you everyone for attending. We will have this posted on our website, and I think you'll be posting it on Freedive Wire as well.
Yeah, I will. Or on the YouTube channel, and then I'll make it known through the website. Yeah.
Okay, that sounds great. Thank you everyone for attending, and thanks again, Jaap.
Thank you.
All right.